Alright, so today we're going to learn how to do an IV insertion procedure on a patient who is undergoing oral surgery. So what you're going to need for this procedure is an administration set, the prescribed intravenous fluids, nitrous oxide analgesia if the patient requests it, and an IV start tray, including a tourniquet, a cleansing wipe, a Tegaderm dressing to secure the catheter, an 18 to 24 gauge catheter, in this case we're using a 22 gauge, a 3 milliliter saline flush, the prescribed sedative medication for the procedure, in this case ketamine, and an administration set, or an extension set, with a 3-way stopcock. Don't forget your gauze or your cotton, for in case the patient starts bleeding. So, what you first want to do, when the patient's in the chair, get them hooked up to monitors, talk to them for a second, to kind of take their mind off. Then start with the oxygen. Once the oxygen has been running for 5 minutes, start to titrate the nitrous dose, little by little, until the patient has reached the peak level of nitrous oxide analgesia. Once the patient is sedated and relaxed, take the administration set, keeping the spike sterile, keep both ends sterile, keep the hole on the bottom of the bag sterile as well as the spike, and insert the spike. Once fluid runs to the roller clamp, you want to open your clamp up, let the fluid run through to the end of the administration set. Once you see that fluid is coming to the end, you want to clamp this end off, keeping all ends of any tubing or any catheter sterile. Then you want to take the extension set and connect it to the administration set. Close your clamp on your administration set. And this is ready to go. Take the 3 milliliter saline flush and connect it to the 3-way stopcock. Prime the tubing with saline. Open the clamp and prime to the end. Now you want to start by finding a good vein. Ask the patient if they've had any IV problems in the past or any problems sticking veins. Tie the tourniquet 6 to 8 inches above the vent puncture site. For most dental sedation patients, the puncture site is the antecubital fossa. Once you've found one of the 3 veins in the antecubital fossa, that being the basilic vein, the cephalic vein, or the median cubital vein, you want to cleanse the area. Cleanse the area with alcohol, betadine, or chlorhexidine in a circular motion for 30 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Obviously, this video is taking long because I have to explain the steps. In the office setting, however, it would be going a lot faster. You want to take your angiocath, twist it around to make sure that it is smooth, and to make sure it'll come off the needle with ease once in the vein. You want to anchor the site, going at a 30-degree angle to the skin, parallel to the vein. You want to go in until you feel a pop, and you see blood flashing back into the chamber of the catheter. At this time, you want to release your tourniquet remove your needle and connect to the intravenous tubing. Once the tubing is connected to the catheter, you want to dress the site with a tegaderm to secure the catheter in place. Write the date of the procedure, the time of insertion, and your initials on the dressing. Flush the catheter with 3 milliliters of normal saline. Once the dentist is ready to begin the procedure, slowly push the sedative agent while watching the patient for allergic reactions on the vital signs monitor. Emergency drugs must be readily available to handle any situation that may arise while the patient is under anesthesia. Open the clamps and allow the intravenous fluid to flow before the dentist starts to drape and prep the patient for sterile surgery. Turn the nitrous oxide off and administer 100% oxygen during the anesthesia procedure. The nitrous oxide should only be used to keep the patient comfortable while the catheter is being inserted at the beginning of the procedure. And that's how you perform intravenous sedation on a live oral surgery patient.